Oregon EMS Data System, EMS Agency User Training Overview. In this session, we'll provide an overview of Oregon's EMS Data System. We'll discuss who uses your patient care reports, where Oregon has been and where Oregon is going with its data system, the national data standard that Oregon uses, what will and won't change for your agency as you move to the new version of the data standard and the new data system, the benefits of moving to this system, what the reporting process looks like within your agency, and system user roles and how to access the system. Who uses your patient care reports? Well, EMTs and paramedics, you're the cornerstone of this picture. You respond to the EMS calls and provide care to the patients. You record information about your calls in your patient care reports. The information that you record is important to several others. Agency administrators within your agency use the information from your reports for agency operations such as billing, and also to understand how to improve the operations within the agency, to identify training needs, to identify staffing and equipment needs, etc. Hospital personnel have access to your patient care reports so that they can provide good care to the patient when you transfer the patient to their hospital. When hospital users log into the EMS data system, they see a screen like this. They see all incoming patient care reports for patients delivered to their hospital. They can choose one of those reports and print it or view it. The information from your patient care reports is important to several others as well. Your county health department can use it for county-wide decision-making and policy-making regarding EMS. The state EMS office and public health officials use the information from your reports for analysis, statewide reporting on EMS, policy-making, and statewide system improvement. Some information from your patient care reports is sent to a national EMS database, where it's combined with information from nearly every other state in the U.S. The information in that national database can be used by researchers and also by federal and state governments and even by you or your local agency to understand how EMS works across the country and to compare or benchmark your EMS agency with national data. Researchers can also use the information in Oregon's EMS data system. They must go through a rigorous approval process to ensure that the information that they receive is kept private and confidential. The bottom line is, the information that you provide on your EMS calls allows us to answer the question, does EMS make a difference? By looking at the information from your calls, we can determine what actions really make a difference in the outcome of a patient, and we can identify ways to improve the system throughout the state so that patients have better outcomes. Oregon's history with EMS data is fairly recent. The National EMS Information System, or NEMSIS version 2 standard, was released in 2004. It was the first widely adopted data standard for EMS. Oregon began collecting some EMS data as early as 2007, but really ramped up its efforts in 2011. In the same year, 2011, NEMSIS version 3 was released, and now all of the states around the country are working on transitioning from NEMSIS 2 to NEMSIS 3. By the end of 2014, 80% of Oregon's transporting agencies were submitting to the state EMS data system. Oregon went live with its NEMSIS 3 data system in July 2015. And the goal is to help all agencies transition from NEMSIS 2 to NEMSIS 3 by the beginning of 2017. So what is NEMSIS? The National EMS Information System is a data standard used across the country. It defines 423 data elements that could be collected on a patient care report. A core of those elements, 131 of them, are labeled as national elements. Those data elements are collected on every patient care report, and they're submitted by the state of Oregon to the National EMS database. They don't contain patient identifying information, but they contain information that is very helpful at the national level to understand what EMS looks like throughout the country. Outside of the national core, each state has decided data elements that it will collect statewide. Oregon has done that and will be collecting 207 data elements. The 207 elements include the 131 national elements. Outside of the national and state data sets, your local EMS agency may decide to collect some additional data elements. For example, odometer readings are not required at the national or state level, but odometer readings may be important to your agency for billing purposes or other reasons, and so your agency may choose to collect those data elements even though they're not required at the national or state levels. Now, are all of those patient care report elements collected on every patient care report? The answer is no. It depends on the call. For example, there are several data elements related to cardiac arrest and your response, including resuscitation efforts. Well, of course, most calls have no cardiac arrest, and so those data elements don't apply to most calls, and they're hidden, turned off within your system. You only have to fill out those cardiac arrest elements when there was actually a cardiac arrest on your call. Also, some data elements are simply recorded by your software under the hood. You never see them, but they get recorded automatically by the software and transferred to the national database. As Oregon switches from NEMSIS 2 to NEMSIS 3, what will change and what won't change for you and your agency? Well, first, the data standard changes. The NEMSIS 3 data standard is much more complete than NEMSIS 2 was. It has much more capabilities. Because the data standard changes, the software also changes. Previously, your agency could use any software product as long as it was compliant with the NEMSIS version 2 data standard. The state of Oregon provided a product free of charge to all agencies that your agency could adopt and use locally, and that was the ImageTrend State Bridge system. As your agency moves to NEMSIS 3, you still have those two options, to either purchase your own product or to use a free product provided by the state of Oregon. If you go with your own product, it will probably look different than what you've used before as you transition to a NEMSIS 3 compliant version of that product. If you use the product provided by the state of Oregon, that will be the ImageTrend Elite system. What doesn't change? EMS data reporting has been voluntary in the state of Oregon, and it will continue to be. But most agencies are voluntarily reporting to the state EMS data system. Now, how will your agency manage the transition from NEMSIS 2 to NEMSIS 3, possibly from an old product to a newer product? That's a great question to ask your agency leadership. Ask them what the plans are and how things will change for you. Let's summarize the benefits of moving to a new data system that implements NEMSIS version 3. The first benefit is improved standardization. We'll have better documentation on your calls because the data standard does a better job of representing what really happens out on your calls. The new system, ImageTrend Elite, is accessible from any device, not just computers, but also tablets and smartphones. And the NEMSIS 3 data standard improves the ability to share information between EMS agencies and hospitals. With these improvements, you'll have better management and better training within your agency, improved ability to identify training needs and have insights into what's happening in your agency. And the bottom line is that these changes and these benefits improve patient care. Let's discuss the reporting process, from the time that you get dispatched on an EMS call to the time that you fill out a patient care report and submit it. So your call starts when a dispatcher sends you out on the call. You respond to the call, and sometime after you start responding to the call, you start your patient care report. Now, you may start your patient care report after you've completely finished the EMS call, but if you can start it early on and work on it throughout the call, you'll be able to have it pretty much done by the time your call is finished. As you fill out your patient care report, eventually you'll decide whether you're going to transport the patient, and if so, what hospital you're taking them to. As soon as you record that destination hospital in your patient care report, your patient care report is made available to the hospital by Oregon's EMS Data System. Hospital staff can access your patient care report before you've even finished it to start to get an idea of the situation with that patient out on the call and to prepare their staff to receive that patient. Eventually, you finish your EMS call, and after you finish the call, you have a few more things to finish up in your patient care report, and then you mark your patient care report completed. After you mark your report completed, Oregon's EMS Data System sends a copy of some information from your report to the national database. After you've marked the report complete, your agency may have an internal review process. A QA officer or a captain may review your patient care report to ensure that it's complete and accurate. They may request you to make some changes to the report, and you can go ahead and make those changes even after you've marked the report complete. If any changes are made to the report, the state EMS data system will resend an update of that report to the national database. Eventually, your agency finishes its review process and sends your report to billing. This is the ideal process for filling out patient care reports as you respond to EMS calls. Your agency may do it a little bit differently, but it will generally follow this sort of approach. Oregon's EMS Data System has a number of different user roles within it. Agency administrators are given the role of EMS Agency Administrator, or if your agency is also a fire department, they can be given the role of Fire and EMS Agency Administrator. EMTs and paramedics, who simply need to be able to create patient care reports, are given the role of EMS Service Provider. But a number of other roles also exist to give access to certain staff members within your agency to fulfill their jobs, whether it's the medical director, billers, QA staff, or training officers. In order to get access to Oregon's EMS Data System, your agency administrator will first create your user account. If your agency used Oregon's previous ImageTrend State Bridge system, then your account has been migrated to the new ImageTrend Elite system. In that case, your agency administrator simply needs to double-check the information on your account and make sure your account is active. Your EMS agency administrator will then give you the user ID and temporary password for your account. The first time you log in with your account, you'll be asked to change your password to something that you'll use long-term. If your agency used Oregon's previous ImageTrend State Bridge system, then your password actually stays the same as it was when your account was migrated. If you have trouble logging in with that password, you can use the password reset process to reset your password. Thanks for viewing this overview of Oregon's EMS Data System. If you have questions or want additional information, you can use the support contacts that are listed here.